Hello everyone. Today I will talk about the Ictal EEG in sunflower syndrome. Are the seizures provoked or unprovoked? So first I will tell a little bit about myself. So I'm Jo. I'm a pharmacist. I'm an MD in training. I'm now in my final year. I have been a researcher since 2013, and I've been focusing on drug-resistant epilepsies. So Dravet syndrome and fenfluramine were actually the major topics of my PhD research. Then I've also been focusing on drug discovery using zebrafish models. And these zebrafish models are very interesting because we can put genetic mutations in them, so we can focus on the genetic epilepsies in these fish. When I was doing my internship in Boston, I got to know sunflower syndrome, and I was immediately very interested in this syndrome, which I've never heard of. And to put it in perspective, so if we now look at the world, I'm from Belgium, so we put it here, this black dot. I'm doing my training to become a medical doctor here in the Netherlands, the other black dot. And then here's MGH in Boston. And what is interesting is actually that sunflower syndrome is not very well known. If I talk about sunflower syndrome here in the hospital in Leuven, Belgium, a lot of neurologists don't even know what the syndrome is. So this world map also shows that we need to create more awareness about this syndrome. But it was actually the major topic of my research was, are these patients with sunflower syndrome, are they inducing their seizures themselves? Because we have always this hand waving, these typical movements, and a lot of people have been saying that it's inducing or mimicking a stroboscopic effect, and that's why it's self-induced, but we want to investigate this question. But first, if I want to talk about this EEG of sunflower syndrome patients and the correlation with the hand waving activity, it's important to first know what is an EEG, what is brain activity. Then I will talk, of course, about these EEG basics. I will also talk about our study in sunflower syndrome patients, and I will end with some conclusions of our studies and future perspectives. So if we go to these EEG basics, so what is epileptiform activity? Because we now are saying, okay, we want to correlate this hand waving with the brain activity. And you can say you have normal activity or you have seizure activity. And we see the seizure activity, we also describe it as epileptiform activity. So we're looking like epilepsy. How do we get these data? So we work with a scalp EEG. It can be something like this with a head, or it can be that the dots are connected directly to the scalp. And it's important to know that this is pain-free, it's non-invasive, so it's relatively easy to do. What we see that there are a lot of different wires, and that you can see that there are different connections on the scalp. I will explain that a little bit better in the next slide. But what is most important is that we have a lot in our brain, we have a lot of neurons, and these neurons, they communicate by electrical signals. And it's actually a very, very small signal. We also have the skull that is actually on top, so we cannot analyze the signal very well. But what is important is that there are like thousands of neurons that are firing simultaneously. So this will give a small signal, and if we then put the signal in this computer that you can see over here, then the signal gets amplified, and then we can see a signal and we can analyze the brain activity. What is interesting regarding its position, so if you look here, this is the head like on top, the vision on top. And you see that there are different numbers, there are different letters, actually just saying, yeah, we call it the double banana because it kind of looks like double banana. And then you can say, for example, on the computer, if it says FP1, then you know that the signal is coming from this part, so the frontal part. And then number 1, so the uneven numbers 1, 3, 5, and so on, they're on the left side, and the even numbers like 2, 4, 6, they're on the right side. So this is very general, very basic. And then we can see a signal. If we are now focusing on this signal, then we can say, okay, there are different activities depending on the frequency. So for example, how many times does the signal go up and down in a certain time frame in 1 second? Then if it's very low, below 4 times per second, then we call it delta waves. If it's a little bit more going up and down, then it's a theta wave. And for example, if you compare it to the gamma wave, then you see it's a very high frequency, what actually means that it goes 30 or 100 times up and down in 1 second. But it's very difficult to say, okay, we see these waves, so this means that it's epilepsy, or no, we cannot conclude that. So a lot of these waves can have different meanings. But what's, for example, interesting, the beta waves, for example, if your child is on benzodiazepines, you can see typically these beta waves. So it doesn't mean that it's immediately pathological, but it can also mean that they're on certain type of drugs. But what I wanted to highlight, so if we have these different regions on the skull and we want to see this brain activity, we want to say, okay, when do you say it's normal activity, or when do you talk about seizures? So this normal activity, so here you have an example of the normal activity. You even see when the eyes when the eyes are open and eyes are closed. So you see, we don't like the term normal activity. We actually say there's no evidence for any abnormal activity. And what you see is it's very sensitive. You can see, for example, the eye opening and the eye closing. You can also see if a patient is sleepy, drowsy, if he's active, if he's fast asleep. So you can see a lot with this EEG. If you then go back to what is seizures or the epileptiform activity, for example, here you can see this is a patient from our study as well in MGH. And what is very important to see the difference with the normal activity is that you have here epileptiform activity as a spike and a wave. So typically, it's not that you expect seizures like it's only spiking. No, you want to see this first a spike and then a typical wave. This is very typical for epileptiform activity or seizure activity. And if, for example, in the sunflower patient, you can really see it that you have the spike and the wave. And if we go back to the double banana system, so then remember the different numbers and letters on the head, you can see it over here on the left. And there you can see, for example, is it more in the frontal region or is it more in the back of the head? So you can see where the activity is coming from. And what is actually interesting, you can then see, is there a focus, a specific focus? Then you can say, okay, it's focal epilepsy. If it's activity everywhere in the head, we call it generalized epilepsy. And this is actually what we see the most in sunflower syndrome patients, that it's actually everywhere in the head. So this is actually the EEG basics. I hope it was kind of clear. The most important thing is to see when you talk about a normal EEG and when you talk about, for example, epilepsy on the EEG, then you typically see a spike and a wave. Then if we look at our study in the sunflower syndrome patients, then we have actually studied different things. So we have looked at the timing and duration of the hand waving. We have looked at the hand waving activity. So which hand is actually involved, which hand is the dominant hand of the patient. Because it's known as a photosensitive epilepsy, we also looked at the photoparoxysmal response. So what is this? I will explain a little bit further in detail in the next slides. So these three things I will now discuss. So actually this study has been published in December 2020. So it's very recently out there. And then we try to answer this question, are the seizures provoked or not? To put it in perspective, we need to go back to 1932 when sunflower syndrome was described, and it was described as a tic. And then future studies or subsequent studies actually said, okay, no, the seizures are self-induced. They're mimicking the stroboscopic effect by doing this hand waving. But then in 1961, already Charles Simmons said, isn't this blinking what he saw in this photosensitive epilepsy? Is it part of a seizure? At the same time, it was also in 1964, Livingston and Torres, they said, yeah, this hand waving is happening at the same time as the abnormal activity in the brain. So it's not happening before, so it's not self-inducing the seizures. And also Frances Ames, she has also been questioning the self-induction. But if we then look at more recent data, for example, in 2018, from Baumer in California, they said that the seizures are self-induced. They were very strict about it. They are self-induced. But if you see these contradictory findings in the past, then you would say, yeah, we actually don't know it. So we need further studies. And that's why we have been studying this hand waving. Is it part of a seizure or not? And actually what we believe is that it's part of the seizure. They're not provoking the seizures. I'll explain why. Because for a provocation of a seizure, it's typically between 1 and 3 seconds. So meaning that this hand waving should last at least 1 till 3 seconds before you see anything abnormal on the EEG. But if we look at our clinical experience in sunflower syndrome, we already see that this abnormal activity is happening before actually this hand waving. So what we see, not only before, sorry, I missaid this. I mean that it's not within this 1 to 3 seconds, but it's before 1 second, then you immediately see this abnormal activity. So if we now put this in a graph, this may be more clear. So actually, if hand waving would last between 1 and 3 seconds, then the events that are in this area, you would expect, okay, this could be the self-induction. But if you look at the events below 1 second, this would not be enough. This is too short. So the hand waving is less than 1 second. This is too short to mimic a stroboscopic effect. So they're not self-inducing their seizures. And what we see for each patient, so we have like these 5 patients over here. And for each patient, there are several hand waving events. And we see that most of them that were correlated with epileptiform activity are below 1 second. So actually, this is roughly 89%. That's below this 1 second. So we believe that this is not self-induced because you need at least 1 to 3 seconds to talk about self-induction. There are also other data suggesting that it's not self-induced. So for example, if you look at the hand waving activity before the epileptiform activity. So with the epileptiform activity, I mean with the spike and wave activity on the EEG. But there is a period, usually less than 1 second, before this epileptiform activity. And what you expect, let's say if there's a very short period of hand waving, you would expect that there's a short period of epileptiform activity. If there's a very long period of hand waving before epileptiform activity, you would expect a long duration of epileptiform activity. This would be true if there's a correlation. Then you would talk about self-induction. But if we then go further and we look at our data on each patient, you see that there's no correlation. So for a correlation, you want to see in the graph the line like this, but the line goes like this and sometimes like this. So it goes, you see that it is not a straight line going up. What does this mean? This kind of assumes that the seizures are not self-induced. If we then look further and we look not only at the hand waving activity, sorry, I went a little bit too fast. If we look at the hand waving activity before, but also combined with the hand waving activity during the seizure, if you then would expect that the total duration, if you now look at the total duration of hand waving and the epileptiform activity, if there is a correlation between this and the epileptiform activity, meaning that if this lasts kind of as long as the epileptiform activity, you kind of say that it's happening at the same time, so that it's, again, not self-induced, the seizures. And indeed, this is what we have found as well. So we found a clear correlation that if there's a very short period of hand waving activity, we also see a short period of abnormal brain activity. If there's a long duration of hand waving activity, we also see a long duration of abnormal epileptiform activity. So again, you cannot say in science, you cannot say we're proving that it's not self-induced, but all these data suggest that seizures are not self-induced. We also wanted to look at the hand waving activity itself. So are they using their right hand, their left hand, and what is actually their dominant hand? And it's very interesting to see, this is a limited study, and we only had 5 patients, but we see that for all these patients, the dominant hand was the right hand. And some of these patients indeed use their right hand for hand waving. Some of them use the left hand. Sometimes for one patient, there was even both hands sometimes getting involved. So this is something that needs further study. If we looked at the region, so again with the double banana on the head, remember, so sometimes you see it more frontal, sometimes you see it more posterior, but for a lot of patients, you see actually epilepsy, the abnormal brain activity, you see it everywhere, so generalized. This warrants further study as well. Last but not least, the photoparoxysmal response. So what we actually doing is we mimic the stroboscopic effect with light. So we call it IPS. It's the intermittent photic stimulation. And what was interesting that 3 out of 5 patients had a clear PPR, as we abbreviated. So meaning that this is a photosensitive epilepsy. If you look to previous research, this photosensitive epilepsy responds well to certain treatments. So you can have environmental measures, or you can have several anti-epileptic drugs, so AEDs. And what is very specific, if you look at these references, Barnett and Baumer, they are saying that valproic acid is actually one of, so it's the dipakine, is actually one of the most effective treatments for photosensitive epilepsy, although we know that for sunflower syndrome, it's often drug resistant. So we need better treatments. So this is, again, a topic that needs further research. But what is also interesting that there are some environmental measures that can be very effective, like the sun avoidance or avoidance of very bright light, or wearing hats or specific sunglasses, but still it's not known that you need this type of sunglasses that works the best. So again, further research is needed for this. And if we can say, okay, we need further research, but if we go back in time, for example, in 1985, there was already a treatment described, fenfluramine, that was successfully terminated seizures in 3 patients with photosensitive epilepsy, and one of them was hand waving. So probably this patient had sunflower syndrome, and fenfluramine was very effective. So it's interesting to see. That's why nowadays fenfluramine is in a clinical trial in sunflower syndrome patients to see that it could be effective. This will be the topic of another talk, but I just wanted to highlight that you see, okay, there are more and more treatments possible. There's more and more research, and this is very interesting. So actually, to conclude, all what we have learned today, hopefully, is that since 1932, there were a lot of contradictions. Were the seizures self-induced or not? And interesting to see is that our study actually shows that if you want to self-induce seizures, you need to have at least 1 second or more of this hand waving activity. And in, let's say, roughly 89% of our patients, it's below this 1 second. So it's not enough to induce these seizures. We have also looked at different things. So the hand waving activity before and hand waving activity in total correlated with the abnormal activity of the brain. And it's very interesting that these data also suggest that it's not self-induced. If we then look at the hand waving hand or the dominant hand, we are not able to clearly correlate this. This warrants further study. And again, with the PPR, we could say, okay, indeed, it's a photosensitive epilepsy, and this can make it more easy for future studies to focus on treatment options. For example, the dipakine, the valproic acid, can be very effective, but that doesn't mean that that is also the dream drug, that this is the best drug. So we need further study for this as well. So you have heard that I said a lot of we need further study. So this was kind of a pilot study to look at, okay, is it self-induced or not? And we believe that the hand waving is part of the seizure, so not self-inducing. But again, we need more awareness, more research and understanding, and of course, a better treatment. I want to say special thanks to all of you for this interesting research. And it's good that a lot of people are working on this to find better treatments. I want to thank Dr. Thiele, because thanks to her, I was here. I wasn't at MGH to do the research. Also, Dr. Laga, who was a good connection between Dr. Thiele and Dr. Laga. He's my promoter here at UZ Leuven, Belgium. And then I want to thank also Dr. Neshe Ayoub and Dr. Liang Sheng Luo, because they have done a lot to get these data also published. So thanks for listening. If you have any questions left, you can always email me, you can always contact me on LinkedIn. So feel free to do so. Bye.